Meantime, a dedicated nurse who retired after 50 years of service was recently celebrated at Christus St. Michael Hospital.
Sue Johnson joined the nursing staff at St. Michael's on this day more than 5 decades ago. KTBS 3's Julie Parr has more on the legacy she's leaving behind.
For more than half a century, Sue Johnson has been on the front lines of the healthcare industry.
I wanted to become a nurse in my early childhood. I always had this passion for helping and caring for people, and I just knew that's what I was meant to do.
Johnson's journey with St. Michael's began as a staff nurse in 1974, but it wasn't long before she was stepping into leadership roles and mentoring other healthcare professionals.
The technology that's available nowadays is so much different than what was years ago. I'm dating myself by talking about having glass syringes to give injections, and nowadays those are plastic syringes, as an example, and there are many other things like that have changed through the years as well.
Johnson says nursing shortages that existed when she was a new graduate 50 years ago still exist today, but technologies have helped streamline processes and reduce the need for some in-person testing.
I think back to my early years as a nurse where patients would actually come into the hospital just for tests. And nowadays, that's done on an outpatient basis. That's not an inpatient visit.
Throughout her years of service, Johnson says one of the most meaningful projects she's been involved with is the free dental clinic they've been able to offer the community. The event is held in partnership with the Texas Dental Association Smiles Foundation.
We've helped so many people who had issues, dental problems, and was able to provide some relief for pain or help them understand what they needed to do for the future.
Johnson was also involved in helping plan the emergency department when the hospital moved from downtown to north of I-30 on December 4th, 1994.
What an experience, getting to move from one hospital to another, as well as one state to another, because you had different rules. As far as at that time, nurses had to have license in every state. Now there's a compact, so as an example, I live in Arkansas and I only have an Arkansas license, but it's valid in the state of Texas also.
Last year, Johnson decided to hang up her scrubs to travel and spend more time with her family. To honor her extraordinary career, the hospital named a bridge on the hospital campus the Sue Johnson Bridge. Hospital administrators say it symbolizes Johnson's lifelong connection to health and the well-being of the community. Julie Parr, KTBS 3 News.
Johnson also served in a city leadership role for 20 years. She was on the board of directors for the city of Texarkana, Arkansas from 1996 to 2016.